What does a contraction feel like? How do I know if I'm in labor? And what does the day of labor look like? Wait, is this normal? Hey, I'm Heidi Campbell, a certified birth doula, host of this podcast, Birth Story, and owner of My Doula Heidi. I have supported hundreds of women through their labor and deliveries, and I believe that every one of them, and you, deserves a microphone and a stage. So here we are. Listen each week to get answers to these tough questions and more. Birth Story, where we talk about pregnancy, labor, deliveries, where we tell our stories, share our feelings, and of course, chat about our favorite baby products and motherhood. And because I'm passionate about birth outcomes, you will hear from some of the top experts in labor and delivery. Whether you are pregnant, trying desperately to get pregnant, I hope you will stick around and be part of this tribe. Hey, it's Heidi. Before you start listening, I just want to jump on here and acknowledge something. The sound recording of today's episode is less than what you are used to hearing on the Birth Story podcast, but there's a reason why. This interview is so important that I traveled all the way to Asheville, North Carolina with one microphone for 3 people sitting around a table having a really important discussion about Black maternal health. So I hope that you can listen past all the imperfections for the beauty of the content in this episode. Hi, it's Heidi. Welcome to the Birth Story podcast, episode 13. I'm so glad that you're listening because this week is Black Maternal Health Awareness Week. And I've traveled to Asheville, North Carolina to record with Maggie and Cindy from MAHEC, Mountain Area Health Education Center, and Mothering Asheville, and Sisters Caring for Sisters. You will hear from these 2 incredibly inspiring women who are leaders in this community, fighting innovatively to change the disparity of maternal and infant mortality rates between Black and white women. I'm recording today to learn, to open my eyes, to reach out across this canyon, and to share that the change must occur. If you are a Black woman in the United States with an advanced degree, you are 3 to 4 times more likely to die in childbirth than a white woman with less than an 8th grade education. Let that sink in. I did not say that pregnant Black moms are more likely to get an epidural. Sadly, you heard me correctly. Beautiful Black pregnant women bursting with life are more likely to die. We are here to talk about why and what can and must be done to erase the statistic and to save lives. So, Cindy and Maggie, thank you for joining me today.
Thank you.
Thank you. We're excited to be here.
Quickly introduce yourselves, and then I'm going to get into a little bit of the numbers.
Okay. My name is Cindy McMillan. I am a DONA certified birth doula. I'm also a Lamaze trained childbirth educator, a breastfeeding peer counselor, and the Director of Marketing and Education for Sisters Caring for Sisters, the community-based doula program.
Yeah. And I'm Maggie Adams, and I'm the project manager for Mothering Asheville, which is a movement here to address the Black-white disparity, particularly in infant mortality, but also in maternal mortality, which Sisters Caring for Sisters is a part of.
Cindy, we didn't talk about this, but I certified with DONA also back in 2008. So we have the same certifying body.
Awesome.
So before we dig in with Cindy and Maggie, I just want to go over some of the statistics that many of the listeners may not be aware of. I'll be honest, when I did the research for this interview, some of this was very new and startling to me. And that's why we're doing this. So in the United States, we are one of only 13 countries in the world where the maternal death rate is worse than it was 25 years ago. Only 4% of physicians are Black. 900 women are dying each year in childbirth in the United States, and yet 60% of those deaths have been deemed preventable. Overall, in the U.S., the maternal mortality rate is 28.7 deaths per 100,000.
Now, that drives me crazy when I read that, because if you break it down, Black women comprise 40 per 100,000 compared to 12.4 per 100,000 deaths in white women. So it's really unfair that we lump those numbers together because it doesn't tell the true story. And we're doing this interview today to try to shed light on the true story. And then also the next worst country in the world for maternal mortality is New Zealand. And their death rate is 3 times lower than the United States at 11.9 per 100,000.
That's sad. So sad.
So here we are. We're going to shed light. We're going to raise awareness. We're going to pave a way for action for maybe other municipalities in the country that are looking to do what it is that you guys are doing here. And we have so much to learn from you guys. So
Yeah, we're ready.
Let's do it.
Let's do it.
So Cindy,
Yes.
let's start with you.
Okay.
Are you interested in sharing your birth story?
Well, I had some very unique birth stories, I would say, for myself, because I was young. I had my first daughter when I was 20, and I almost died while and pregnant with her. That was when they didn't quite know in 97 what hyperemesis was, and it was horrible. That was my only natural birth. And then my second son, 5 years later, I got pregnant with twins. And I remember kept telling the doctors that and I think I was like maybe 4 months. And I kept stressing to them that, I think I'm having more than one baby in here. It's more than one. And they kept saying, no, we saw only one baby. We only saw one baby. So around my 7.5 month, they realized I was actually having twins. And one of my twins had a heart defect. So they was trying to work diligently then to try to see what they can do in vitro. But there was nothing they can do except let me go ahead and have the twins. I stayed in the hospital for about a month before they would actually do the delivery. I went under general anesthesia and my delivery. And when I came to, I remember my bed just being wet, soaking wet, and there was so much blood everywhere. And I remember trying to talk, and I was telling the nurses and, screaming for my husband at the time. And I just kept bleeding. And the doctor came in, and I'll never forget, and she was like, you need to stop bleeding or you're not going to make it. So in my mind, I was like, what am I doing to make myself bleed? So I kind of just relaxed myself while they did what they had to do. I was preparing myself to die in that bed. That's all I kept thinking was like, I hope my sons are okay. I had not had a chance to see them yet or anything. And luckily I made it through that. But the hard part was the hospital taking my son that had the heart defect, and they forced a blood transfusion on him when he didn't need it. And my other son, who's actually here and that's alive, he needed a blood transfusion, but they didn't give it to him. And no matter what I said and what I did, they took me to court to take custody of my son and gave him the blood transfusion. And within, say, 3-4 days, he was dead. So that was my trust of the healthcare system at that point, because I was like, they wouldn't listen to me. They wouldn't listen to me, and I almost died. And then my son had to pay the sacrifice because the doctor was not listening to me, because I knew my bloodline, my blood history. I knew my mother had blood clotting deficiencies. I knew that my sister had passed away from bleeding disorders. And instead of them doing the research and the homework like I was asking them to, they didn't. So that was the drive to the work I'm doing right now. When I found out about a profession that actually supports women and are there to be the extra ear and and really be there to be by their side. I was so hurt because that wasn't what I had experienced, even with my husband being there, or if he didn't know what was going on. He didn't know how to support at that time. And he wasn't trying to respect my wishes, which were, if something happens, this is what I want you to do. None of that was respected on his end because he was in his feelings. But a doula is totally different. She has no judgment. She's letting you experience this birth your way. Things may go wrong, and I understand that. But it's always better to have somebody there that's understanding and empathizing with you along the way.
When you were pregnant and you were preparing for your birth, first of all, I have a million things to say about, I'm sorry that they didn't listen to you. And I'm sorry that they didn't hear you when you know your body. You knew there were 2 babies in there. Mm-hmm. And they didn't discover that until 7. I mean, that's just unbelievable to me, but 7 months.
Yeah, that's 7.5 months. Yeah.
So I'm sorry to hear a story. And we, as doulas, are fighting to advocate for our moms. But back then, had you ever heard of a doula? Did you think to have like someone besides, your partner to be there?
No, I never knew what a doula was. We hear stories about my grandmother, she delivered at home, so you've never heard about somebody supporting you. You heard about your grandmother's mother being there to deliver the baby, or, all those.
The real doulas.
The real doulas.
The real doulas.
So it was always a thing of, well, this is what a woman has to go through when she starts bearing children. You kind of just deal with it. Nobody at that time was preparing you for the emotional things that you was going to go through. All the changes, all the physical changes, the emotional changes, when you compile that labor and pregnancy on top of a past, whether it's good or bad, mm-hmm. You're compounding a lot.
Yep.
It's a lot of stress there.
Yep.
And most Black women, including myself, didn't have a very rosy past. So not only was I pregnant now, but I was also traumatized as a kid in different areas of life. Yep. So like sexual abuse, I've been there, been raped, been there. So when it came down to that delivery, I was worried about my body image. I was worried about how I'm going to react to touch. I was worried about light or male doctor, female doctor. I was just, is someone going to take advantage? I was just so concerned about the things that past history. I wasn't in protecting my kid. I would never let anybody hurt my kid again like that, like I was hurt, or I would never let anybody, my whole framework and my mind was different. If I had somebody there to talk to, I could have relieved some of that and been more,
I'm going to interject right there because we're going to get to this, I guess, with you. But I want to say that with the clients that I've worked with over the 15 years that I've been a doula, that the trauma piece is like the biggest piece in my world to birth outcomes.
Yeah.
I have plenty of moms that call me and say, I really want to have a natural childbirth. And then we start digging into it, and I find out that they have been getting raped, mm-hmm. sexually abused, have big traumas. And one of the things as a doula that we have to teach and train is that childbirth is very difficult, and it will gut you to your core. And all of your things come out.
Yes.
So of all the things that we talk about, and we're going to talk about today with labor and delivery, one of the pieces I think that's hidden is what we bring to birth. When those contractions start and you are forced inside yourself, you're going to face some things that you maybe didn't want to face.
Yeah.
And those are that's probably another whole topic for another day. But birth outcomes related to past trauma, and then where that leads you. So you had so many things. You had trauma. You had a baby at home already. Now you're pregnant again with a medical community that's not listening to you.
Yeah.
And then I'm sorry that your baby died.
Yeah. Yeah, it was rough. It was rough. And I don't want another mom to ever have to experience a healthcare profession not listening to them, I always look at them as they're practicing medicine, and there's always a bedside manner. But sometimes you got to listen to who you're taking care of. They know their body way better than anybody. You know what I'm saying? I think in the Black community, I had never had high blood pressure before, but I caught high blood pressure when I was pregnant. And all that stress, and that was my third pregnancy with my other son. And I got high blood pressure really bad. And then I started thinking, I'm just not doing this right. Everybody else have this lovely pregnancy and lovely, they can be big and pregnant and eat what they want to eat. And here I am just so full of stress. My blood pressure is shooting out the roof. I'm getting headaches. And that's it's fluid. And then they'll go cause cesarean, and you don't be wanting that either, but then you understand on one end, this has to happen because your blood pressure. Doulas, we help alleviate some of that stress.
Yeah.
You can throw that weight on us. We hold that space. I love that. Mm-hmm. I love that. You don't have people out there that do that. So I'm like, where was Doulas in 97? It wasn't in my neighborhood.
The first birth I attended was 2005. And I'd never heard of a doula either, but I had a friend and she said, just come be with me. I need someone with me for this birth and can support me. And I walked out of that delivery room. I thought, my whole world just changed. Mm-hmm. And my sister said, you were her doula. And I said, what is a doula? So this is going to help me transition to bring Maggie in, because you told me when you were pregnant, you didn't know what a doula was. I didn't know what a doula was, but now here we are, two doulas. So how does that happen? Enter Maggie.
Yeah, so I didn't know what a doula was 5 years ago either. So this work that embarked where Sisters Caring for Sisters was born started about 4.5 years ago with a grant through the Blue Cross Blue Shield Foundation and of North Carolina, Blue Cross Blue Shield of North Carolina Foundation. And it was a grant that came out called the Community Centered Health Home. And it was based off a model that the Prevention Institute had come out with that really said there's factors outside of the healthcare system that are contributing to health inequities and health disparities. And so at that time, I was working at MAHEC, and MAHEC OBGYN had applied for that grant. We had no idea what we were going to do with it. It was one of the first times that we started thinking about like, hey, let's do this a little bit differently. And so when we first started doing this work, we had no idea that we were going to be focusing on Black-white disparity, or I've learned recently we really want to be calling it an inequity, because disparity is just a difference, where an inequity is preventable and unjust. So that's one of the things in language that we're trying to shift a little bit. But when we started this grant, what we wanted to do was start building trust and relationship in community.
How much money did you get from Blue Cross Blue Shield?
So $125,000.
Okay.
And
free autonomy to do whatever you want with the money? Or did they direct you guys?
I wouldn't say like free autonomy, but for the most part, yeah, it was like we don't know what to do. We want you guys to teach us how to do it and tell us, what you're figuring out and how you do that. And the model really says that the idea is that there's 3 things that you really have to be doing simultaneously to improve outcomes. And that's that you have to build community capacity. You have to make a clinical shift. And you have to address the policy and the environment where people live, work, and play. And so what happened was that we had started 2 groups. One group, which was in Piscoview Apartments, which is a public housing neighborhood here in Asheville, North Carolina. In Asheville, public housing is primarily occupied by Black people here in this city, which is due to historical trauma and institutional racism. A lot of that started in the 70s with urban renewal and just kind of continued to transfer on and on and on in this city. And Asheville today stands as, the second most gentrified city in the United States. Our Black community has continued to lessen and lessen every year. We are seeing this as public health people and not really understanding, all of the context. We're also white women that are like, okay, we're going to go try to build trust in a community with Black women. Don't really know what that's going to be like.
So let me stop right there. Does that mean everyone that was working on the grant was white?
At that point, yes.
At that point, okay.
Yeah, which is pretty typical.
Okay.
Most of the times, us white folks love to write grants to go into Black communities and fix them. That is literally the pattern that we have seen for so long.
Amen.
So it's I laugh about it, but it's really messed up. That is what is done over and over and over again to Black communities. And no wonder why there's no trust. No wonder why the Black community doesn't trust the white community, doesn't trust the healthcare community. We just come in and we're like, oh, we're white. We're going to fix this. We know how to do it. But we don't know anything about you. We don't know what it's like to be a Black person living in America. We don't understand what it's like to be disenfranchised and have everything taken away. But we know how to fix you.
Yeah. So I'm going to interrupt right there.
Yeah.
So let's answer that question. So Cindy, you are a doula.
Yeah.
You are Black. Yeah. You are in this community. You know what it's like.
Yes.
So let's answer Maggie's question that she's putting out there.
Yeah.
What is it like we just heard your story, but also the stories of the women that you're serving right now through this program, which I guess we don't get to in a minute how you're doing that, but tell me about who they are, how they feel about healthcare, how they feel about hospitals, how they feel about their pregnancies.
Now we're going to take a short break to just share a few things with you, and we'll be right back with our guest. I'm so excited to tell you about my first book that I wrote that is launching this summer. It's a 42-week guide to your pregnancy. It's a collection of birth stories. It has a ton of doula advice from all of the questions that my clients have asked me over the last 14 years. It has hysterical partner tips that you will want to read to your partner. And it has journaling prompts because nobody has time to write 20 pages in their journal about their pregnancy. So I've taken the liberty to give you some prompts of things that I think you might want to remember back on after the baby's born. So again, you can go to birthstory.com and pre-order a copy today, and it would mean the world to me. Hey guys, if you're enjoying this podcast, then I need your help to spread the word. If you know anyone who is pregnant, is trying to become pregnant, or just loves a good birth story, if you could send them to iTunes or Stitcher or Spotify or SoundCloud, wherever they listen to their podcasts, and ask them to subscribe to the Birth Story podcast.
Well, it's sad, but Maggie is hitting the nail on the head. She's absolutely correct. And even now, there's no trust. There's no trust. I mean, if it wasn't for the fact that Maggie and the other ladies that did come to Piscoview and actually genuinely wanted to build a relationship without no one knowing the background noise, without, they would take their time, rain, sunshine, we would sit at a picnic table, and they would genuinely hear us out instead of coming in and saying, well, we're bringing this to the community. It was none of that. They gave us the freedom to come up with ideas and freedom to...
They empowered you.
They gave us the tools to actually empower ourselves.
Awesome.
Because certain things that they knew about that was going on within the community didn't reach our community. So once they started saying, well, we have an invitation here, would you guys like to show up? And we're like, okay, getting some more information. And once we heard, on top of each one of our doulas, all of us, we have adverse birth stories, something just unsupported. Went to a conference and heard about the infant mortality rate here in Malcolm County. And it sent us into like a rage. We were so upset. We were so hurt because in our minds for years after we had our kids, I always thought that the government was trying to kill us. The healthcare system was trying to kill us. Why is there so much unfair treatment with Black women versus white women? If this was I would say if I wasn't Black, my son would still be here. If I wasn't Black, I wouldn't have bled like I did on that table. They would have been there to take care of me. Things would have been explained differently. I couldn't prove that for a fact. I couldn't say that for a fact. I just know how I felt. But now, as a doula, I actually can see it. So I wasn't wrong. Now it's like, you're watching it in action, but why? Why would a healthcare provider get into a field where he cannot equitably treat every woman, child, person the same? Why would you take on the role of being in charge of someone's life when you can't do it equitably? So then I started thinking in another way of money talks. So we're pawns. Our bodies are pawns. Our kids are pawns in a money exchange. I can't prove that. But that's what it's all seems like it's coming down to. On top of, we're Black. We hold no value in the world. And it shouldn't be like that. And I feel that it's so unjust. Our moms love our children just the same as any other mom. Mm-hmm. Our moms sacrifice for their children just like any other mom. Once you get pregnant, you can't go back. I see them fighting for abortion rights and abortion this and abortion that. What do you think about a mom who's pregnant and loses her child? What about a mom who's pregnant and loses her life? That should be held on a higher pedestal than someone who's saying, I can't do this right now.
Right.
What about the ones that's doing it right now?
You can't fight to be pro-life and to save lives if you're not going to support those lives.
Exactly.
You're right.
Which I think is also what you see a lot when there was the contention over the Women's March. And it was that this is a white women's march, right? Because a lot of that idea is especially as white liberals, oftentimes we have these ideas about, how progressive we are and how we're doing all of this work for women's rights without looking at the intersectionality, how much privilege we actually have as white women versus the privilege that a Black woman does not have the same as, right? And so that's what we're seeing so much of, right? Is that we are getting to this point where not understanding that literally just as much as we're seeing Black people shot and killed, Black babies are dying and Black moms are dying because of the healthcare system. It's the same thing.
Same thing.
Yeah. It's so interesting that you say that. And I'm going to say something I probably comment away, everyone. But how much privilege a white woman has who's straight, who's married to a white man. Mm-hmm. Whether we want to believe it or not, we get more power and more privilege when we marry a white man. Mm-hmm. Mm. So I hear you. Yeah. So let's go back to how Maggie and Cindy are connected to have helped you know what a doula is and to become a doula?
I'm so looking at our women because life starts with us. You know what I'm saying? We birth children. We populate, you know? So, you know, they always say which came first, the chicken or the egg, you know? So we are an intricate part of society. Whether you black, white, green, purple, it doesn't matter. Why the inequitable treatment? I mean, we're in 2019. This is a whole nother generation. This is a whole nother, I mean, we're actually at a place where we should be having each other's back. We're supposed to be supporting each other, looking out for each other. And to have a racism play such a big role in healthcare, that's scary. That's scary and sad.
It's hugely scary. So Maggie, as part of MAHEC and this grant and this initiative, like, what do you see? You put doulas in place and you have been so creative and so novel in creating a system for change. But what were you seeing? What are you seeing?
Yeah.
You mentioned 3 pillars earlier.
Yeah. So I want to first start by saying, like, the doulas are actually who chose, the ladies that are the doulas now, without any influence from us white people, chose and said this is the solution that we have decided that we want.
Oh yeah, we chose that.
So when you went into the community and you said, I have no agenda, let's talk.
For a year and a half.
Yes, for a year and a half.
For a year and a half before we did anything.
With no, this is the way we're going to do it.
Yeah.
It's how do you want to do it? What solution does this community need?
Yes.
Cindy and your peers said, we need women supporting women during their pregnancy, during their labor, during their delivery, and their postpartum care. We need a Black woman supporting a Black woman through their healthcare.
Yeah.
In your community, how many Black OBGYNs are there?
I haven't seen any.
Okay.
I haven't seen any. And you know what? We have women asking for one all the time, and we can't produce them more. Yeah. But they love our support. I mean, they love our support, and we hadn't seen Black nurses either until up to recently, you know what I'm saying? So it's a little change at a time, but it's
So where did the term doula kind of surface? And when you're having these community conversations, someone must have known what a doula was.
We had Melissa Baker, one of our dear friends, amazing woman. She invited Chama Woydak, and she got all of our, she told us she was inviting Chama Woydak to the table. This was our first time actually sitting down with Chama. And
so who is Chama? Tell everybody who Chama is.
At the spa day event, too.
Yeah,
that's where we met.
We met her at a spa day event we had for the picnic table. We decided to do a Mother's Day event for the women in Piscoview and make it a de-stressor, And Chama came and she tabled one of the events where we had massages and acupuncture and food, and it was just relaxing, candles. And she ended up coming to the picnic table, and we didn't know at the time that Chama was a doula. She had her own doula company. And
what's the name of her company?
Homegrown Babies.
Homegrown Babies, and she's here out of Asheville.
She's here out of Asheville.
Okay.
And she came to the table after we mentioned all the things we really wanted to do. After it was angry, she was like, "I have a skill I would like to teach you, ladies, if you were willing to learn." And it was like, okay, what's the skill? What's the skill?
This is where I'm screaming and jumping for joy.
And she was like, doula. That was the first time we actually heard the word. Now, we was thinking support and this and that for women and Black women, health disparities, infants dying, And when she said doula and explained what a doula was, we was like, oh, yes. Oh, yes. It's
you have a fancy word for woman caregiver? Yeah. Oh, okay.
Yeah. So we was all excited, and it was like, eager to learn what this job entailed. So
that it's a job.
Yeah, it's a job with a certification. You know, well, it's like I be certified in something that could actually benefit our community. And we started the training in November 2016. And we were so excited. It was after we started learning it, we didn't want to stop learning. And we haven't stopped learning. Each year has been
so
amazing.
The training came from Chama and Homegrown Babies.
And our grant.
And
So
the
this
grant,
is-
I was going to say, I was like, someone had to pay for this.
So this is where it comes in, right? Is that so we decided we wanted to do stuff and do things differently. And a lot of that came from understanding the historical context of how Black people in Asheville had been historically disenfranchised over and over again. And so that's why we were like, okay, we're going to take a step back. We're not going to come with a solution. We want to first build a relationship. We want to understand what's going on from a perspective of people that actually are living the experience that we think we understand. And our healthcare providers that have been involved with us from the beginning can talk to that much better than I can, of like this preconceived notion of like all the reasons that Black women and Black babies are dying without even thinking about the historical context of racism. And so when Cindy's talking about like racism today, that's only a product of hundreds of years of racism and slavery and Jim Crow, forced sterilization of Black women up until recently. Black bodies have been like used and abused over and over again by white people. And if we didn't have that historical context, I think we wouldn't have been able to kind of take that step back. And so that's been a really important part of our work, is having that historical knowledge. And so when the ladies had this spa day event, which they were like, this is what we want to do. Stress is what's one of the biggest factors that like we see. We want to give people a chance to just relax. We said, okay. And when they said, you know, we want this doula training, that's the whole idea, right? Was, all right, you have a solution. We have the money. We have the resources. Let's make it happen.
Yeah.
The Doulas, Sisters Caring for Sisters, was born and birthed through these ladies. And so that's where kind of the story comes from.
So creative, innovative, blessing, empowering. Thank you, MAHEC. Like, thank you guys for just not being another group of white people pushing your agenda on a community you don't know anything about. Like, this is so revolutionary. There are mayors and people that have Blue Cross Blue Shields and United Healthcares of the world that could hear this and say, like, this is something it can be replicated, it can be modeled, it can be shared across the world, but across the country. So where are we now? So Cindy, tell me about Sisters Caring for Sisters.
Sisters Caring for Sisters, we have really evolved in the past several years. When you were saying what you was just saying, it made me think that one of the other beautiful parts and pieces to this that I am so thankful, and I know the other ladies are really thankful for, is we're able to help bridge the gap and the trust within the community of women and the healthcare providers here at MAHEC. A lot of the women we support are patients of MAHEC, and so because we are working so closely with the healthcare providers and we're working so close with the community, we are able to kind of show the community every healthcare provider isn't that bad. And every healthcare provider, we can explain their roles, and vice versa.
And what happens if you come across a healthcare provider that needs some cultural or sensitivity training? Like I've been at births where I didn't like what I saw, what went down.
Neither one of
what happens?
Neither one of us ladies are silent.
Good. So this is giving you a platform to change.
We're not silent. We're not silent when we're in the hospital settings. We're not silent. And here on campus at MAHEC. And one of the reasons why is because in order for this to be successful, you're going to have those hard conversations. You're not going to agree all the time, but it's called respect. respect that this is a whole different culture than you're dealing with. And the culture itself got to respect this is who has been kind of put into place to be your healthcare provider. And if you don't like them, you can always request another one.
Yep.
You know, you don't have to be stuck right here.
Yeah. I heard something that does give you more voice and more power. So Frank Castablanco, executive director of MAHEC, shared with me that because of the training from Chama and Homegrown babies, through the training through DONA International, which is a certifying body, that the doulas here that are part of this program have been given a MAHEC badge to wear to the hospital.
Yes.
And I'm thinking that comes with power.
And we're also one of the doula programs. Sisters Care for Sisters and a lot of the doulas here are open to go into the operating room with our clients if it just so happens to be a cesarean. And, you know, that is amazing because our support doesn't stop. It doesn't stop. We're there. We're considered staff, you know.
You are staff. You're paid. Cindy's full-time benefits.
This is unbelievable because that support should never end.
Exactly.
Just because the birth went from a vaginal delivery to a cesarean delivery.
Exactly.
Your support system should be able to be trained to be by your side for the whole entire process.
The whole process.
So, okay. Pause, rewind. Because I'm just so excited. I've got so many things. Tell me about how you engage the community to know about now, a couple of years later, that we have 6 doulas on staff. We're here to serve you. How does a woman who becomes pregnant today find you, get your services, and then walk me through your process, your doula process, your doula. What do you do for these women for the A to Z?
Well, right now we have a lot of systems in place to get our name out. Sisters Care for Sisters is well known within Piscovia apartments, and one reason is because we also host a mother-to-mother program for women in the community with kids, and we meet once a month, and we just talk about everyday life and get things off our chest. It's a group of women. I mean, they're amazing. I mean, they just open up about concerns, stressors, things going on in their life. A lot of them have newborns or older kids. So we didn't stop our picnic table. It just evolved. Okay. And we get more women.
That fellowship is just growing.
It's growing to know that we're supporting our women in all avenues. We are known here at MAHEC. We have a doula that works with the centering program. So she's with pregnant women all the time. We do a lot of speaking events. We have our Facebook kind of little platform.
We have partners.
Yes. They love. We have partners.
How many women, like, what's your capacity, like, per month? Like, how many women could you, I mean, because you have to, to be a doula, you have to be on call. I mean, you have to not sleep in the night, you know, women go into labor at night.
Yes.
You have to do prenatals. You have to build a relationship. I mean, so what's your capacity?
Right now we are really busy. This year has turned into a really, really busy year, which is good for us. We're having one of our doulas. She's actually doing 3 to 4 births a month. Okay, well, that's a lot. That's a lot, and she's
doula to doula. That's a lot.
We have another one who's doing about the same. Mine are more spaced out because I also do the marketing and education. So I'm also in the process of getting my certification for teaching for my LCCE. So that takes a lot of studying, but my books are still full. Yeah. I'm doing like 1 to 2 births a month.
Okay. So if I hired you today, or I was calling you and saying, you know, I want you to be my doula, tell me where to sign. I want to join your program at MAHEC. I want to be part of this. Then what happens?
Whereas you want to be a doula or you want to be a client?
A client.
Well, first we have a referral system set up now.
Okay.
So our women go through who wants to doula from SC4S, they have to meet certain criteria.
Okay.
Now, and one of the main criteria is being African American, being a woman of color.
Okay.
It doesn't mean that we only serve women of color, but that's one of the criteria to actually you take precedence over everything else. We also work with teen moms, too. So, but once we do that, and then we have a doula call you once we go through the criteria, your risk factors, things that's going on. Usually a referring doctor will refer you, or for a healthcare physician. And then our director of operations will give you a call and tell you who your doula is. And then within a week, a couple days, that doula will call you and set up a meeting so you guys can sit down and talk to see if you're a fit for each other. You may not be a fit for each other. We haven't had one that hasn't been, I don't think, but we see if you're a fit for each other. And if it clicks, then choose your doula. And we don't set it at like 31 weeks, 32 weeks. We take you from the moment you're ready for a doula. It could be 19 weeks. It can be 11, 12 weeks. When you feel like you need that support, you need that support. Who can put a time on it?
Exactly.
Who can put a month on that, a week on that?
Yeah. I have had moms that have hired me like the second that they found out they were pregnant. A lot of moms that did IVF and had long fertility journeys and just knew that they needed that support from, the moment they started. It's beautiful. I believe that the longer gestation you have with your doula, the better the outcome.
I think so too. I really do, because you get to spend so much more time with them, walking with them, spending that time. Questions. I'm sure you're getting so many questions like, oh, I don't feel so happy today. What's going on? And you're able to say, well, what can we do to make you happy? What would you like to do today? I'm free for a couple hours. Where you want to go? Want to go for a walk? And then that little bit shows that somebody really does.
And is listening. Do you go to the doctor's visits with your clients?
Yes.
Okay. And do you call them clients?
I call them clients. I call them moms. I call them by their names.
Yeah. I just didn't know. I was like, I call my clients my clients,
I call them sweetie, depending on,
Just wanted to make sure you didn't say patients. No patients. I hate the word patients.
No,
so I always say, I'm like, if more hospitals would treat all women as customers or clients and not patients, I'm like, usually when you're pregnant, it's not a national emergency, a little more customer service.
I try not to even think of them as clients either, because that sounds so business-like. Because even though this is a business, you want it personal, because it is personal. You're in that personal space. So I tell these moms, they're my sisters. Our sisters care for sisters means sisters. We sisters, we got each other's back. That's what sisters do.
We'll get the direct referral from a healthcare provider or from a partner within a community organization around us that are then saying that, but then there's also word of mouth. And so that's where that big clinical shift is that there are community-based doulas that are also within a healthcare clinic that are able to build that connection like Cindy was talking about earlier. And
this hearing you talk just brings me back to all those terms again. Yeah. Novel, innovative.
I wish if you're listening, it should not just be covered with Medicaid as well. I think all over the board, every woman deserves a doula. Every woman should have a doula within childbearing age. It's a must. It's a must. I say that. I promote the midwiferys. I promote the doulas. I think those two combined, we're really onto something. Yeah, something big.
Yeah, I actually just had United Healthcare cover my services in full for all AT&T employees. So I will give a big shout out on this podcast that I at least have one employer that is paying for doula services in full through commercial insurance.
See what I mean? That's amazing.
There is change that is it's brewing, it's coming. That's why we're here. So I want to go back to, are you 100% hospital-based? What if one of your mamas said, I feel the most comfortable birthing my child in my home? Or is there a birthing center here?
Yeah, we have a birthing center.
So tell me about that. What are their options for delivering in this program?
They have the option of the hospital or the birthing center.
Okay.
Yeah. And let's just say this, how traumatic some women are because of our healthcare system. We had a mom who actually delivered at home because she was
afraid to transfer
to the hospital. So, and that goes to show how traumatic them hospitals can be for our community.
Like she knew the baby was coming and was like, I'm not going anywhere.
And then what happened when she did go to the hospital?
When she did go to the hospital, they was ready to take her baby away.
For no other reason other than delivering at home?
Yes.
For anyone listening outside of North Carolina, home birth in North Carolina, for some reason, we could have a whole podcast on this, is illegal. So I'm assuming that this happens quite often when you have let's call it an accidental home birth. I have also had clients that had accidental home births in precipitous labor. I've had, but then had a load of paperwork. So even they call 911, the ambulance comes, the baby's already here, and they get to the hospital and they are immediately trying to enjoy and embrace the beauty of life that just occurred. And all that's happening is judgment, anger. You could have, I can't help that my water broke and I had the urge to push. I'm 45 minutes away from the hospital in traffic. Mm-hmm. Thank you, healthcare community, for your judgment. Yeah. But I'm here now. So anyway, lots of tangents. I could just, go on. So let's talk about actual labor and delivery. So you've done the prenatal care, you've built the relationship, and then your mama calls and says,
I think it's time to go.
It's time. Do you labor with them at home?
If that's what they want, we leave that totally up to them. We ask them to call us. Don't text. You can text any other time except when you think that you're in labor. If they're uncertain, we make sure we say, well, why don't you call your healthcare provider, see what they say, call me back and, let me know what's going on. I can come over, labor with you, walk with you, whatever. Usually if it's time to go, then I'll be like, meet you at the hospital, and we get there. I usually get there while they're still in the OB/ER.
Pause for a minute. We have spoken that this community many times is low income. Is transportation to the hospital an issue?
As doulas, we're not allowed to provide transportation, which would be amazing if we did, but we don't. So usually they will have somebody bring them over.
Okay. Is MAHEC allowed to provide money for Uber or Lyft or, something if transportation were an issue?
We're not there yet. Okay. We're working on it.
See where I'm getting at, though?
Yeah.
It's illegal to birth your baby at home, but yet we don't help moms get to the hospital with transportation.
Yeah.
Okay, that's just one nugget.
That's nuggets.
There's 100 nuggets. 100 or 1,000 nuggets.
Yeah.
Okay, so you get to the hospital one way or the other, but you have to meet them there since you can't provide transportation.
Right. Mm-hmm.
And then you've got your badge.
Get your badge.
Like, boom, MAHEC, Doula, DONA certified, homegrown babies trained.
In my purple scrubs.
You wear your purple scrubs.
That has Sisters Care for Sisters on one side, MAHEC. OB specialist on the other side. Yes. And my doula bag with all my little necessities. I have my massage oils, my essential oil spray bottle. But we got the beauty of our moms get to wear whatever they want to labor in.
So they don't have to wear the hospital gown?
They don't get told that unless we tell them.
Advocate. See?
Yeah.
You have to have someone advocating.
Yes. Yes.
for you.
They don't know that, our hospital have a certain amount of wireless monitors. There's some of them don't know to ask for wireless monitors so they can move in. And not going to offer them to you.
Yeah, or intermittent monitoring, rather than continuous monitoring.
So we come in handy,
So you're massaging, you're laboring. Do many of your moms prefer a natural childbirth or a medicated epidural birth? Do they have a strong opinion either way?
A lot of the moms, once they realize that their doula has some tricks in the bag, and you kind of coach them through certain things that you're going to do, you're willing to do to help alleviate some of the pain, the pressure, counting them through it, actually telling them and showing them what their body's doing, they'd be more apt to want to try it without any interventions.
Good.
But we always let it be known we don't judge you. We don't. Yeah. It's just your birth. However you want to labor, we can work with you. Yeah. If you get that epidural, we can still labor in that bed. You're good.
And right there, what you just said, they're getting a voice in their ear that they're not getting anywhere else that says, this is your birth. This is your body.
Yes.
You have choices. You have control. What do you want?
Yes.
So going through the labor and the delivery and getting to know this, and we've already mentioned in your community that we just don't have any Black OBGYNs. What do you want to share with the medical community across the country? Like if you are a white OBGYN right now and you're thinking, I don't want anyone to feel I'm not doing this on purpose. I don't want to make the Black women that I serve feel like they are not heard, which is the biggest issue here with institutional or structural racism, is Black women voicing and then being shut down and not heard. So what advice can you give from this community, from your experiences, to white OBGYNs across the country?
Across the board. I would definitely say we would really appreciate if they stop judging a book by its cover, because it's deeper than that. I would like for our healthcare community to find that place of empathy. If you can't, for some reason, see past color, then try to imagine that being your mother or your sister or your aunt in that bed, or even your grandmother. Because at one point in time, you wouldn't be here without going through this same process. And you know things about the body, and you know how the body works, because that's what you go to school for. Transfer some of your your education into humanity. It's the humane thing to do. You know what I'm saying? I see more people take care of their animals, better care of their animals than Black women. That's hurtful, and that's coming from a Black woman. That's just real. We're no different. We're no different. We love our children. I don't care what lot in life we've had, how much finances we have, how dark our skin color is. It does not matter. So I think they need to just take a step back. Let's take a step back and look. It's no difference. Only thing you're seeing is skin color. Start looking at us as people, as women, equitable women. We deserve it.
Yep. Thank you for sharing. Thank you guys for saying yes to this conversation and for teaching me and for sharing your story. And as we kick off the week this week for Black Maternal Health Awareness, I just really appreciate you being here.
Thank you for listening to Birth Story. My goal is you will walk away from each episode with a clear picture of how labor and delivery might go, and that you will feel empowered by the end of your pregnancy to speak up, plan and prepare for the birth you want, no matter what